What are the key factors of hand hygiene and why is it crucial in healthcare settings?
Well, how long have you got? So this goes back a long time, before germ theory and Louis Pasteur really nailed the transmission of infectious organisms between people as the cause of disease. Even before then, people observed that if you do a better job of washing your hands and introduce hand hygiene, then you reduce infection risk. Back to Semmelweis in Vienna in the 1800s. But even now, the message hasn't really fully caught on, and we still get staff questioning the evidence base for hand hygiene, which is frustrating at times, but also understandable, because we should be promoting evidence-based medicine, and the quality of evidence for hand hygiene could be better. However, I'm convinced that hand hygiene really is probably the biggest single intervention we can do to reduce transmission risk across the board. I think the reasons why members of staff in an acute setting don't wash their hands are complicated and multifactorial. We have issues to do with the availability of hand hygiene products at the point of care. The gel is empty at the end of the bed, there's one missing. Those kinds of issues happen more than you'd expect. And we have systems in place to reduce those and to mitigate that risk in terms of hand hygiene performance. Staff are motivated to give the best patient care, but we also have some inherent drivers of behaviour that are unfortunate when it comes to hand hygiene. So we have a very strong sense of self-protection, not selfishly, not consciously, but we are driven to protect ourselves from sort of cave people days, and that means that some of our triggers for hand hygiene are not there when they ought to be. So a classic case is, if you look at hand hygiene compliance, on average, it tends to be higher after patient care than before patient care. Because after patient care, we have that psychological trigger to say, my hands are contaminated, I need to do hand hygiene. So part of it is around educating ourselves and being aware of our own unconscious biases in order to achieve the best levels of compliance. And then it's about trying to get improvement cycles in place with real data that means something to people and will really trigger improvements in hand hygiene behaviour.